contrary to what many people think, back pain is actually very common in people with scoliosis. In fact, the majority of people with scoliosis actually develop back pain. You see, one study actually looked at teenagers that had scoliosis, and they found that the majority of teenagers with scoliosis had some type of back pain. However, the back pain was generally pretty mild and adult pain. And what's also interesting when you look at teenage populations, the severity of the pain tends to be directly correlated to the severity or the size of the curve. Meaning in teenagers, the bigger the curve, generally the more severe the levels of pain. That's completely different in adults. When we look at adults, pain is the number one reason someone actually seeks treatment. However, the size or the severity of the curve is not correlated with the severity or the levels of pain. Hi, I'm Dr. Chris Kuhl's leading authority in the non-surgical treatment of scoliosis and hyperkyphosis. And if you're an adult and you're watching this, I'm going to encourage you to click on the link below and request a free discovery call. That'll give you a chance to talk to me one-on-one about your scoliosis, how severe it is, how likely it is to progress, and most importantly, what treatment options may be available to you. Now, if you're watching this video, it's likely either one, you have scoliosis and you're looking for different treatments or different signs or symptoms of scoliosis, or you have back pain. You may or may not have scoliosis or may not be aware if you have scoliosis, but you may be trying to figure out what could be potentially causing your scoliosis. So in this video, I'm going to help you understand how common back pain is in patients with scoliosis. I'm going to show you how pain and symptoms are different in patients that have scoliosis compared to patients that don't have scoliosis. And I'm going to show you which potential factors with scoliosis are the things that actually cause pain and which of those do not cause pain with scoliosis. So let's dive in by looking at a brief research paper that actually looked at adults with scoliosis. So let's dive in by looking at a research paper that actually looked at adults that had low back pain, and they aimed to identify how many of those patients had scoliosis. So in this research paper by Robin et al., they looked at 554 adults that had back pain. These are people between the ages of 50 and 84. And they found that 30% of those adults that had back pain also had scoliosis. Now, what's interesting is they looked at the same group of patients 5 years later, and they found that at that point, 5 years later, 40% of those had scoliosis. So you had people in this age group that had back pain that didn't have scoliosis that later on developed scoliosis. So two things. One, we know it's very common for adults to develop scoliosis later in life, and that could be a scoliosis they had when they were younger that gets more severe, or it could be a new scoliosis they develop in adulthood. Two, we know it's very common for people with scoliosis to have back pain, or in another way to look at it, it's very common for people with low back pain to have scoliosis that's actually causing their pain. So, are there predictors of how pain presents in someone that has scoliosis compared to someone that doesn't have scoliosis? This is a research paper that actually looked at multiple different papers, and they wanted to identify is how does pain present different adults that have scoliosis compared to adults that don't have scoliosis. And they had a few key findings. If you look at this graph, over here on your viewing right side, this represents patients that do not have scoliosis, and then the picture over here on this side represents people that do. And what they found is in adults that have low back pain that do not have scoliosis, generally their pain is more axial, it's generally more in the midline, and patients that have scoliosis, it's generally more asymmetrical, and it's generally on the side of the pain. In fact, the pain level is generally the most intense at the peak of the curve or the apex of the curve. Another key difference is in adults that do not have scoliosis, they generally get radiating pain down the back of the leg, which is also known as sciatica or a sciatic type pain. But in adults that have scoliosis, they more frequently get pain down the front or the side of the leg or thigh. Now, the reason being is scoliosis in the lumbar or thoracolumbar spine tends to be in the mid-lumbar or thoracolumbar. And the nerves most commonly irritated in lumbar scoliosis are actually in the femoral nerve, and those nerve roots actually control the front and side of the thigh. Versus adults without scoliosis more likely get nerves irritated in the lower part of the spine, which are part of the sciatic nerve, which controls things in the back. So big takeaway, in adults that have scoliosis, they generally get pain on the side of their scoliosis, and adults that don't have scoliosis generally get pain in the middle or the center of the low back. Also, adults with scoliosis typically get radiating symptoms down the front or side of their thigh, and adults that don't have scoliosis typically get pain down the back of your leg, which is also known as that sciatic or sciatic related pain. Now, a couple of the other findings that the authors talked about in this paper is adults with scoliosis typically get increased back pain with standing for prolonged time, and over time, they typically increase back pain with sitting for longer periods of time. Also, adults with back pain typically get pain down their legs with standing or walking for long periods of time. So we know that symptoms typically present differently in adults with scoliosis compared to adults that don't have scoliosis. But what actually causes pain in scoliosis patients? Now, posture or the compensation of the scoliosis is actually one of the biggest drivers. I was meeting with a surgeon this last week, and he said what's interesting is we find that scoliosis, which is actually a spine deformity, he said the deformity itself is not typically what drives the pain, but how someone has to compensate and adapt to that deformity, that's typically what drives the pain. And that's very interesting because it's the adaptation to that deformity that we typically treat or try to work on improving in adults. Let me explain. You see, in adults, we have something called postural balance or balance of the spine. And postural balance is one of the key things we look at for treatment and also what's causing problems or symptoms related to scoliosis or any kind of spine deformity. Postural balance is a predictor of developing pain. The bigger the postural imbalance, the higher the likelihood of pain and dysfunction. And postural balance can be improved in adults. We cannot change the actual deformity of the bone in adults, but the postural imbalance and sometimes the cob angle can be actually improved. So what do we actually mean by spinal balance? Well, there's something called anterior sagittal balance or sagittal alignment. And over here, normally if you looked at this is a line that's dropped down from your lowest cervical vertebrae. This line comes straight down, and that normally would intersect back here at the back of your sacrum. This one is going forward. It's called an anterior sagittal balance or anterior sagittal alignment. This is the number one predictor of pain, disability, and loss of function, and negative impact on health-related quality of life. And so this is what this typically looks like. When someone has scoliosis, they'll bend their knees, they actually tilt their pelvis back, but you see their body starting to lean or hunch forward. This, when it gets greater than 4 centimeters, that's a high predictor of pain, decreased physical function, poor self-image, meaning someone doesn't actually like how they look. They don't like their overall body. They're embarrassed by how they look because they know they're getting hunched over. And it also has association with poor social function, meaning people can't physically do things they would normally do to interact with other people, so it diminishes their overall quality of life and decreased social function. This right here is actually the number one predictor of pain and disability in adults with scoliosis or any type of spine deformity. So what this looks like on this diagram over here, you can actually see the person upright, and you can see over time how they can start to hunch and translate forward, and that causes a lot of pain and disability and problems in their lower back. It causes a change in the normal curve of their spine, which is called a flattening of the lumbar lordosis. And we're going to talk about that a little bit later in the videos. So when someone gets a change in this profile, it's the adaptation to the pain that's the problem. So when they start to lean or hunch forward, it causes a loss of the normal lumbar lordosis. So normally you should have a nice curve in the lumbar spine, and it causes a flattening or a decrease in the curve in the low back. It causes their pelvis to tilt backward. So the pelvis right here starts to tilt backward, and they get a buckling of their knees, and then their body translates forward. It's this compensation to the spine deformity that actually drives the pain. Now, when we look at someone from the front or the side, that's called a coronal view, you'll see in the next slide they start to shift or lean to the side. And that's what we see here. So normally, the upper back or lower neck should be lined up with the center of the pelvis. This is called a coronal shift. And again, when that gets beyond about 3 to 4 centimeters, that's a high predictor of pain and disability. The bigger that gets, the more loss of function someone has and the greater pain levels. This is what it looks like in that patient. You can see them leaning over to the side. Their body's literally collapsing under the weight of gravity. Now, a few other predictors of pain beyond coronal balance and sagittal balance. Here's a paper by an author called Schwab, and he looked at what kind of findings on x-ray are actually high predictors of pain. And some of the ones he found were a lateral vertebral oleolisthesis or lateral listhesis, or a slipping of the vertebrae. That's what you see right here, where the vertebrae is actually sliding off. You can see these are all in alignment, but this one's not in alignment. It's the lateral listhesis, especially if that gets over 6 millimeters. That's a high predictor of pain and also the likelihood of curve progressing. He also found that when you have high L3 and L4 end plate obliquity angles. What he mean by that, this is the L3 lumbar, L4 lumbar. If you look at these angles compared to the horizon, as those get greater, or those vertebrae are more tilted, that's a high predictor of pain and disability. And the loss of lumbar lordosis, or a decrease in the curve from the side of your spine. So let me show you what some of these things actually look like on an x-ray. Here's an x-ray. I'm going to pair someone with the severe pain and degenerative scoliosis. This is L4 and L3 lumbar vertebrae. Here we are measuring the L3 and L4 obliquity angles, and those are pretty steep. So those are high predictors of pain in someone with scoliosis. We talked about that lateral listhesis. Here you can see this bone is slipping off the top of this one. This is greater than 6 millimeters. That's another one of those things that's a high predictor of pain in scoliosis. And then a loss of the lumbar lordosis. Here you can see this, there should be a curve like this right here. This is a circle. You can see the spine is actually reversed, or there's actually a kyphotic or reversal of that normal lumbar curve. So in a quick recap, we know it's very common for people with scoliosis to have back pain. In fact, if you have scoliosis, you're more likely to have back pain compared to someone that doesn't have scoliosis. We also know back pain presents differently in patients that have scoliosis compared to those that don't. If you have back pain, your pain is more likely asymmetrical, meaning on the side of the curve, compared to being in the center of your spine. And you're more likely to get pain down the front or side of your thigh as compared to if you don't have scoliosis, you're more likely to get it down the back of your leg. Now, the size of the curve is not a predictor of severity of pain or how likely someone is to actually get pain. But there are several factors when we look at someone with scoliosis that are predictors or drivers of the pain. Probably the two biggest one is when someone has major changes in overall spinal balance, meaning they get a big shift to the side or they start to lean or hunch forward. Now, to learn more about scoliosis in adults, make sure you download our free ebook called Scoliosis Knows No Age Limit. And if you have scoliosis and you're trying to figure out what to do about it, click the link below, request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis. We'll go over the severity of your scoliosis, how likely it is to progress and get worse, your biggest concerns, and probably most importantly, what treatment options may be available to you. Now, to learn more about different treatment options for scoliosis, click on our next video, and I'll see you there.